This could be potentially important because even though you might not have symptoms of the original infection, you will be able to know whether or not you have been infected using this kind of a test. And it seems as though the virus follows what we normally would see, which is if there isn't that much of a change in the virus, hosts develop immunity to it. And so if that's the case, can we have blood tests quickly that would check for antibodies? It could be very helpful if we could check for antibodies because we could see who was actually infected, how widespread is the infection, and if it is widespread enough, you might be able to actually, at 50, 60, even 70%, get into herd immunity, where the virus would not spread as fast and you would not have to do isolation. In addition to that, you wouldn't have to worry about personal protective equipment in healthcare providers who already have antibodies because they wouldn't be able to get the disease again. Here's an article that was published in Science that looks for new blood tests, and they basically go over the same things that we've been talking about. Companies have been racing to develop antibody tests. Here's one out of Icahn School of Medicine at Mount Sinai. They posted a preprint yesterday describing a SARS CoV-2 antibody test that they've developed. It's a relatively simple procedure, and other labs could easily scale it up. And then they go on to describe exactly what we've talked about, where they find this spike protein on the outer coat to see whether or not it will bind to antibodies if they're there. And if they do bind to these receptor binding domains, as we talked about, then it would trigger a detection so that you could see whether or not the antibodies are there. Here's another antibody test, Biomedomics, who's still seeking FDA approval on this COVID-19 rapid diagnostic. In terms of the sensitivity and specificity, let's take a look at that. This was published in the Journal of Medical Virology, the development and clinical application of a rapid IgM. Remember, we talked about IgM being in the acute phase and IgG being in the more chronic phase, combined antibody tests for SARS-CoV-2 infection diagnosis. The overall testing sensitivity was 88.66%, meaning that if you had a negative test, you could be 88.66% sure that that was not a false negative result. Additionally, specificity was 90.63%. That means that if the test was positive, there's a 90.63% chance of it being a true positive. Again, high sensitivity means that if it's negative, you can rule out. High specificity means that if it's positive, you can rule in. And in both cases here, we've got good results. So we hope that this test gets FDA approved soon so that we're able to do antibody testing to see who has had the disease already and may not have known it. That'll give us an idea about herd immunity and how fast this virus is going to continue to spread. Remember that if 50 to 60% of the people in a community already have tested positive for the virus, it's very difficult for that virus to spread much more. Also, healthcare workers can be tested, and if they're positive and have already had the disease, and that could potentially save equipment for those that have not yet tested positive.